Hello everybody, this is Rochelle Burchett with CM Alexander Marketing Group. Our special guest today, Dr. Kevin Huffman, is a nationally recognized expert in the field of bariatrics. He's a board-certified bariatric physician and a leading medical authority on obesity, metabolic diseases, and the medical and surgical treatment of those diseases. He has served the bariatric and medical and surgical community for over 20 years. Dr. Huffman's diverse background in obesity care includes National Medical Director to over 200 commercial weight loss centers and bariatric medical consultant to several major medical corporations. Dr. Huffman is going to answer the question that so many people have been asking. When you go online to look for a bariatric weight loss surgeon, how do you find a really good one? Dr. Huffman, thank you so much for joining us.
Thank you, Rochelle. That's a great question to ask, and I'm often surprised by how infrequently patients actually research their bariatric surgeons. It seems like they spend more time researching their gardeners than they do the bariatric surgeons. So it's very important that they do research. And the best place to start is actually the primary care physician. Their primary care physician may have worked with these bariatric surgeons in the past. They may have had patients that have had surgery by these surgeons as well. Now, we're a close-knit community, the medical community, so the primary care physician may even sit on a committee that reviews the cases of the bariatric surgeon. So it's important to start with the bariatric surgeon, or I'm sorry, start with the primary care physician, get his or her input, and then begin asking patients. Go to some of the support group meetings, go to some of the informational seminars, even go on to some of the virtual support group meetings that we have one through our BMI system where patients can go in and ask other patients about the surgeon. So you need to do adequate research, and it's important to shift out some of the advertising from the core competencies that you're judging.
Okay, great. Well, you know, I always check online for reviews before I do business with any company. So today people can go online, type in a doctor's name and city, and find out what kind of reviews that they have and what people are asking about them. So how important do you think it is to check out a doctor's reputation online before you actually select one?
I think it's very important to check out every aspect online, not just the marketing aspect, because a lot of times what you do is you'll go online and you'll be overwhelmed by all their marketing and advertising. And it's not always the surgeon that does the most marketing that's the best. You know, it's just like lawyers. You know, it's not the lawyer that does the most billboards or radio ads that's the best. Sometimes it's the surgeon that you can hardly find but has a 3-month waiting list. So go online, speak to some of the patients, get some of the feedback, but then also follow that up by going to some of the professional societies like the American College of Surgeons, the American Society of Bariatric and Metabolic Surgery. You can find in those databases information about this surgeon as well. You can also go to the hospital and ask the hospital about information. What you're determining here is not how well the surgeon produces weight loss, because the surgeon is a mechanic. It's about their mechanical skills. You want to find a surgeon that does a lot of surgery. You may find a surgeon online that's on the Dr. Oz show, that's traveling and lecturing and writing books. Well, where does he or she get time to do surgery? The key is that they need mechanical skills. They need to do this frequently to drop down their potential risk. So you're looking for somebody who does a high volume, that does surgery every day, not 1 or 2 a year, but 1 or 2 a day. And you can research them through the American College of Surgeons, the ASMBS, and you can contact us. I've been in this field for 25 years. I know most surgeons in the U.S. and internationally, and so I'll help the patient determine which surgeon or surgery is best fitted for them.
That's great information. Thank you so much. Now, with many weight loss surgery options available today, how does someone choose the best weight loss surgery option for them?
Well, that's a lot goes into considering that. Your age, your comorbid medical conditions, that means do you have diabetes or sleep apnea or otherwise healthy? Are you a fertile female, or do you intend to have children shortly after surgery? A lot goes into the decision-making process, including the skills of the surgeon. if you have a surgeon that you really like and he or she only does one surgery, it may limit your surgical options. Many patients now are traveling domestically and internationally for surgery, so they have many more options. But the key determinant for the surgery is best made in conference with your primary care physician and the surgeon. And after talking to the surgeon, talking to your primary care physician, and maybe talking to some of your friends or colleagues that have undergone surgery, you can come up with the surgery that seems to fit you best.
Okay. Now, I've heard that some doctors who perform weight loss surgery may not have been specifically trained as bariatric surgeons. So how does someone make sure that their surgery is being performed by a board-certified bariatric surgeon and not just like a foot doctor or some other type of doctor?
That's right. Well, early on, there were very little training processes for bariatric surgeons because it's a new field of medicine. But now these young docs coming out of these institutions are going through comprehensive board certification in general medicine and then doing fellowships beyond. So you can ask to see the resumes or CVs. You can ask the hospital to produce that data, and you can actually follow up. If they say they trained at the Cleveland Clinic or Mayo Clinic, you can go back and check that out. And that's critical that you do that. But what's more important is the frequency, again, of the number of cases they do. They could have the most stellar training, but if they're doing 1 or 2 cases a year, you may want to go to somebody who doesn't have such a stellar background in training, but they're doing 1 or 2 cases a day, and they've done thousands of cases. So it's all about the numbers. Another thing to keep in mind, many times we're gravitating towards these high profile surgeons, the ones that are on Dr. Oz and that do the lectures and all that. Well, they may not be doing your surgery at all. It's probably one of their residents or fellows. So when you meet with a surgeon, ask that surgeon, are you personally going to be doing my surgery, or is it your colleague or your resident or fellow? And there's nothing wrong with a colleague, a resident or fellow doing the surgery, but if they're doing it, you want to talk to them. You want to interview that surgeon.
Okay. Now, how long does someone how long does someone continue to lose weight after their surgery? And
that varies quite a bit. I've had cases where patients have gone on and lose weight for 2 or 3 years, and others have lost weight for 6 months and started regaining it. On average, it's about 18 months. We, in the field, in the aftercare market, and that's where my specialty is. I'm not a surgeon. I'm a bariatric medical doc, and I help patients and their primary care physicians make sure that that surgery, which is just a single intervention, creating a tool that allows us to help the patient lose weight, that the aftercare is really the critical aspect of continued weight loss. But it seems that about 18 months patients kind of fizzle out with their weight loss. Now, it's important that they get a lot of weight off during that 18 months. So rather than just sit on the couch and wait for the weight to go off, we encourage them to become active, change behaviors. We even have some patients taking medications during that phase to get fairly aggressive during that phase. I've had patients that have regained some of their weight or all of the weight, and the key is again the aftercare. So there's a lot of variability of how long you'll lose weight, but it's not determined so much on the surgery as it is on the aftercare program.
Okay. And how much weight can a person expect to lose after weight loss surgery?
Well, that varies quite a bit too, from 100 to 600 pounds. It really does vary. And those who need to lose less have less aggressive surgery. If a young lady came in to me and said, geez, doc, I've got 110 pounds to lose, I want to have children right away, I'll put her in a less aggressive surgical process, such as an adjustable gastric band. If I've got a 55-year-old male that's had multiple chronic diseases, and he's got diabetes, I may say, you need a gastric bypass. But it really, again, the key here for patients to understand is that surgery is a one-time single intervention. It takes about an hour, and you want somebody that's got very good skills at cutting and sewing, and that they don't have a very high rate of morbidity or mortality. And that's what you're judging these surgeons on, their mortality, morbidity rates. How many people die after surgery? How many people have complications? You don't judge them on the outcome or the total weight loss, because that's dependent on the aftercare program. Now, the bariatric surgeons may have an aftercare program that improves outcomes, But again, the surgeon himself or herself is simply a technician that is creating this tool. And we want to make sure that they create that tool without complications. So it's critical that you ask about the 30-day and 90-day morbidities and mortalities.
Okay. Now, Dr. Huffman, what makes you different than everybody else when it comes to bariatric surgery education?
Well, I guess the biggest thing is I've been in the field for 25 years. I'm an old-timer. I've been around a lot longer than most of the surgeons. I'm a former trustee to the American Society of Bariatric Physicians. I sat on the medical committee of the American Society for Metabolic and Bariatric Surgery. I've been in the surgical society longer than most surgeons, but I'm not a surgeon. So I have nothing to sell you. I'm not selling you my surgical skills. And I have no financial relationship with any surgeon anywhere. So I'm here to give you a non-biased professional opinion, help you, your primary care physicians, find the right surgeon, find the right surgical procedure, and then implement the all-critical aftercare program. And that's where we at Bariatric and Metabolic Institute really work well, is we help patients after surgery. We actually help with the pre-op phase and make sure that they get to surgery safely. But then after surgery, we engage the primary care physician, we have virtual supports, and we have a lot of information that ensures patients do well out, have ultimate outcome that they desire. So I'd like to have our patients that are viewing this video download the guidelines that I've created, because it really will help them in choosing the right surgeon and the right surgery. But most importantly, get us engaged with your primary care physician, because we can help ensure that the surgery does well, that you don't lose weight short term and then regain it, but that you lose weight over a long period of time. And finally, what I like to do is ask patients to follow up at our site. I've just created another guideline on nutritional supplements. So many patients are consuming supplements that are unnecessary and potentially dangerous. And so we've created a supplement guideline as well to make sure that patients that are using medications, vitamins or supplements post-operatively are doing so safely. Our concern is first the safety of our patients, and second, the outcome of our patients.
Excellent. Well, Dr. Huffman, you provided some really great information today. Thank you so much for coming on. And if viewers would like to get more information, they can go to your website at bariatricandmetabolicinstitute.com. People can go there to download for free the ABC Guide to Bariatric Surgery and the must-have bariatric surgery checklist for patients, including the crucial questions that you must ask before choosing a weight loss surgeon. So if anybody wants more information on how to find a really great, well-qualified weight loss surgeon, or to find out if the one that you're considering using is truly qualified to do bariatric surgery, you can actually contact Dr. Huffman at www.bariatricandmetabolicinstitute.com or call him at 866-270-5116. So Dr. Huffman, I want to thank you once again for being such an industry leader when it comes to bariatric surgery. Thank you so much for joining us.
Well, thank you for the opportunity to discuss this important topic. Thank you.